Hi everybody, it's Belinda Kirkpatrick here. Thank you for joining and I hope you are all having a fantastic day. Seeing lots of great things at the expo I've been joining into and it's been great. You'll have to excuse me doing this from my bedroom. I'm in self-isolation, so hence the backdrop. So a little bit about me. I'm a naturopath and a nutritionist and I've been in clinical practice for over 17 years. I specialise in reproductive medicine and have a master's degree in reproductive medicine. I'm super passionate about fertility, women's health, hormones, and I work a lot with many IVF doctors and specialists to really try to kind of help fertility clients and patients like yourselves to achieve their dream of a happy, healthy, full-term pregnancy. So I have a clinic in Double Bay in Sydney. I also do online consultations and I've also developed some courses to allow more people to really access my services and expertise. So I've got an IVF support course and also a fertility, natural fertility course that's online as well. And you can grab all the details of those if you want to come and visit me in my booth at the expo today. So thanks again for joining. So I thought I'd kind of give you a little bit of kind of conception 101. Now, I know a lot of the information that you're probably digesting today has been very specific, looking at maybe IVF or egg quality, male fertility, and all those things are really, really important. So it's great that we're kind of covering all those things off. In my practice, I tend to find that some people, even either before they've started trying to conceive or like many of you, maybe a lot further down the fertility journey, a lot of people still don't really understand the kind of the basics of conception, when they should be trying, how to identify ovulation, and these things are really important. I've had multiple long consultations with couples, you know, and I go through, you know, when they're exactly trying, how do they know if they're ovulating, and some of them actually don't know exactly when that is and may not even be trying at the right time. So they may think that they've been trying for 6 or 12 or 18 months, whereas in actual fact, they may have only had a couple of conception attempts in that time. So we're going to talk about that today. We're also going to be talking about some important sort of foods for fertility, what we can be doing with our diet and lifestyle, but really covering off that conception 101. So I think it's really important to understand, for a lot of you may not have much experience with naturopathy or nutrition. So I thought I'd give you a little bit of information about how I treat fertility, you know, what is preconception and what is this kind of all about. So naturopathy is looking at your diet, your lifestyle. We use nutritional supplements and possibly herbal medicines to not only treat deficiencies, but also to improve kind of health status and really kind of balance your hormones. So when I see women or couples in the clinic, we go through everything that's going on for you. So your entire kind of health history, what's been happening with fertility or not happening, periods, and absolutely everything. Because fertility really is the pieces of the puzzle coming together. And for a lot of people, I guess what we're looking at when we're looking at subfertility, I hate the words unexplained infertility, makes me want to scream. It's not unexplained infertility. Infertility is when you're not going to have a baby, i.e. there's no sperm or there's no eggs and that partner isn't able to have their own biological child. Luckily, there's so many other options to become parents, and you know, whether it's with donors or surrogates and things like that. But infertility is a very kind of finite word when we're looking biologically. I much prefer to call it unexplained subfertility or just subfertility, which just means that maybe it's not as easy for somebody to conceive as it is for somebody else. Now, sometimes there's one big thing that might be causing that subfertility. And what I tend to find with my clients, one of the things we do after their initial consultation is to go through with a fine-tooth comb, order lots and lots of blood tests, swabs, urine analysis, semen analysis, and work out exactly what's going on. So I'm a bit like a detective working out the pieces of the puzzle. Now, with some people, it may be that they've got, you know, one sort of big thing that's interfering with their fertility. It may be a thyroid condition, or it may be some kind of immune condition, or their tubes may be blocked or something like that. Now, for most people, though, their subfertility is a little bit of a what's the straw that broke the camel's back. And what I mean by that is that it might be that your vitamin D is a little bit low. Your luteal phase, which we'll chat about in a second, may be a little bit short. It may be that your thyroid's fine, but it's just a little bit underfunctioning, or what we call subclinical hypothyroidism. And each or any one of those individual things may not and probably wouldn't be enough to make it more difficult for you to conceive. But when we put all of those things together, sometimes we then start to kind of get this sort of like what I call, what's the straw that broke the camel's back? And so we're looking at all of these factors together to then improve fertility overall. So naturopathy really is, I guess, a whole system of medicine. It certainly, for me anyway, is not alternative medicine. It's definitely complementary medicine. So the way that I work is very integratively. I want my women and couples to achieve a healthy pregnancy. And yes, doing it naturally is amazing, and if that's an option. But if we need to pull in progesterone support, thyroid support, IVF from the medical kind of profession, then we work really closely with those and make that kind of happen. So it's really about trying to kind of draw everything together. And hopefully that's what you're getting today, getting information from acupuncturists and specialists and naturopaths or dietitians, and you're able to really kind of improve that overall health, which then helps to support optimal fertility. I always say to my clients that the worst side effect of sort of working with me or working with a naturopath is that you get really healthy. And so a lot of the tests and things that we go through are really important for fertility, for conception, for pregnancy maintenance, also for a healthy pregnancy and postpartum period, but also too, it's probably the best health check that you'll ever have. And a lot of my clients that come over from the States, they've got so many blood tests and things like that they've had done because of the way that their medical system works over there. So much of it's private. And so, doctors do tend to order a lot more tests. We're lucky enough to have Medicare here to cover a lot, which is fantastic. But we also tend to have less testing because of that. So we don't maybe have as full a picture as somebody else. So it's really important that we don't just guess and that we know exactly what we're kind of working with. And that has to do with hormones, with nutrient levels, as well as more complicated things like immune issues, blood clotting disorders, and other things that can really be affecting your fertility. So back to conception 101. Okay, now I think it's really important that we understand the menstrual cycle. Now, for a lot of us, this takes us back to year 5 or year 8 when we first started learning about periods. And if you're anything like me and most of my clients, you learnt that women will have a monthly bleed, that's your period, use a tampon or a pad, and from that point on, you could have a baby at any time that you had sex. Thank you very much, education system, for that intricate details. Now, when I start teaching women that I'm working with about ovulation, how to pinpoint ovulation, a lot of them are very much like, why didn't I learn this in school? What's kind of going on? And look, I often say to them, were you ready to learn about it at 13 in front of your mates at school? Probably not. So the more women that really understand fertility, cycles, ovulation, not only is it helping you now understand your body, understand when you're fertile, it also helps you understand when you're not fertile. So, for a lot of people, by the time you've had a baby, there's probably a period of time where you don't want to conceive, even when you've finished having your babies all together. There's going to be maybe a longer time at the end where you don't want to conceive. And if you're not wanting to go back on to hormonal contraception or Marinas and copper IUDs and things like that, it's really important to know when you're ovulating and when you're not ovulating. So this information is really important. Now, I'm hoping that this women's wisdom that is becoming a lot more widespread and understood will actually then be passed on to your potential daughters or nieces or special girls in your life, you know, that are younger than you, to allow them to understand at a time that's appropriate for them. So as I said, a lot of us probably don't want to hear about ovulation in year 9 at school, but you know, when somebody close to you or your child is developmentally ready, you can explain these things. And certainly my 2 teenagers understand ovulation, they understand cervical mucus, and you know, I think it's really important that we understand our bodies. So the menstrual cycle. All right, now this is really confusing. Now menstruation starts with day 1 of bleeding. Now that's semantics. Who cares what you call day 1? You know, it does matter in an IVF cycle, and it sort of matters when you're trying to work out when to conceive naturally. So day 1 is the first full day of bleeding. If you have spotting leading up to your period, that's actually considered the end of the cycle before, rather than the beginning of that cycle. So day 1's the first day of flow, where you need to be changing, you know, your sanitary items. And what happens at this point is that estrogen and progesterone drop, which causes the lining of the uterus, the thickened endometrium, to break down. And that menstrual bleed contains blood cells from the uterine lining, as well as cervical mucus. If you get a little bit of brown spotting before your period, just for a day or so, that's totally fine. It's nothing to be alarmed about. It's just that that red blood is coming out quite slowly, mixing with cervical mucus, and it's becoming oxidized. So oxidized meaning, like, you know, when you cut an apple, leave it out, it goes brown. It's being exposed to oxygen, or rust in a car. You know, that blood's just coming down slowly and oxidizing. So don't be too worried about just a little bit of brown spotting beforehand. If you get a couple of days of spotting before your period, it may be that your progesterone levels are a little bit low, and that might be something that you want to talk about with your healthcare provider. So during the period, most women are using tampons or pads. Maybe you're using menstrual cups. Amazing now that there's these period undies, these Modi bodies and things like that. If you haven't gotten onto those, oh my gosh, do it. Saving the planet and saving all of your headaches, which is fantastic. When we're talking about tampons and pads, though, really consider that if you're still using those, sorry to the environment, try to make sure that they're organic. Now, when I say organic, I don't just mean, oh, because everything should be organic. You're basically, cotton is one of the most heavily sprayed crops. And a lot of us are eating organic food or trying to, you know, minimize toxins and pesticides and things. But yet some months we're actually inserting tampons that are very, very sprayed with chemicals and often bleach inside of us, you know, for multiple days in a row, which is probably not ideal. So if you do still use tampons and pads, please do look for organic, unbleached. They're in the supermarket. They cost $1 extra. Find them on special, buy heaps, and, you know, they don't go off. You're probably going to use them at some point. Hopefully you're pregnant soon, but you will need them again at some point. You know, at some point. So these sort of pesticides and herbicides and sprays that are on them and bleachers, you know, have been shown to negatively affect health and hormones. And so topical application of them in your, you know, most reproductive areas isn't really advised. So the follicular phase of the menstrual cycle starts on day 1, and that's when the pituitary gland in your brain starts to release FSH, or follicle stimulating hormone. Now, when we're testing baseline hormones, I tend to test them on day 2 or 3 of the menstrual cycle so that we can compare them each month or to somebody else and know exactly where they should be. So at this point, we're looking at estrogen being at what we call baseline. So maybe it's around 100, 120. Much more than that is a little bit high. Much less than that is a little bit low. We're looking at FSH, or follicle stimulating hormone, and LH, luteinizing hormone, being fairly evenly matched. Now, I quite like FSH on day 2 or 3 to be under 10. Certainly, if you were doing an IVF cycle, I would want that ideally under 15. Now, as we get older, as we become kind of closer to sort of perimenopause, that FSH number will increase because the pituitary gland in the brain is having to send multiple messages to the ovaries. Come on, release your hormone, do your thing. And the ovaries are not really listening particularly well. There are some natural things we can do to help to kind of reduce FSH. It's not guaranteed in the sense that it is a natural part of aging, but there's certainly things that can help, you know, when it's still kind of like fluctuating. So FSH and LH work together to basically get your hormones, get your ovaries to release these little follicles, which causes a rise in your estrogen levels and starts to get the uterine lining to thicken. Ovulation then generally occurs around about 2 weeks before your period. Now, you know, if I was in charge of things, I would have made ovulation 2 weeks from when your period started, because it would be really easy to calculate. It's pretty hard to calculate back 14 days from a date when you don't know when it's going to come. So if you've got a 28-day cycle, it's really nice and neat, and you're probably ovulating around about day 14. If you've got a 30-day cycle, you're probably ovulating around day 16, because we're counting back 14 days. Now, for those of you who have quite an irregular cycle, you know, maybe 1 week, it's 1 month, it's one cycle, it's 26 days, maybe another cycle, it's 32 days. You could be ovulating then anywhere between days sort of 12 and 18. So do be aware of this, because for those of you who are using fertility trackers, I've got a fertility tracking app called Seed that I've created. Gives you lots of information about all of this sort of stuff, recipes, tests, what to do when you're trying to conceive, already loaded in there. It's just for iPhone. Sorry, Android users. Wasn't rich enough to develop it for that yet. No, it might be coming. But basically how all these trackers work is that they take an average of your last 3 cycles to then calculate when they think that you're ovulating and your fertile window. So if, for example, your period is quite all over the place, but you have a couple of cycles in a row that are quite similar, it may be that it's calculating from those, but you could go back to having your shorter or longer cycle that wouldn't be unnatural for you. So if you do have an irregular cycle, the way that I would calculate ovulation, and we'll talk a little bit more about how to tell when you're ovulating in a second, the way that I would kind of calculate your sort of ovulation would be take your shortest cycle and your longest cycle, and then assume that you're ovulating somewhere between each of those dates. So use your tracker as a guide, but know that for you, it might be that you need to lengthen out that fertile window a little bit more. So after ovulation, we enter the luteal phase of the cycle. Now, an egg only lasts for 12 to 24 hours. So once you've ovulated, that egg is done and dusted. Now, because good quality sperm lasts for 3 to 5 days, conception sex is all about the sex that you have leading up to ovulation. Once you've ovulated, it's either happened or it hasn't happened, and that's it. Now, for those of you who've been trying for quite a while, you might be trying to pinpoint ovulation, and you're like, okay, we're just going to have sex at ovulation. Now, really, you want to get as many tickets in the lottery as you can in the fertile window, in terms of try for more conception attempts. But sometimes once you've been trying to conceive for a really long time, that does become difficult for some couples, and that's really understandable. But just make sure that you are trying before ovulation if that's you, because once you've ovulated and that egg only lasts for 12 to 24 hours, you don't have another chance after that. So say, for example, you have a 28-day cycle, you know you're ovulating on day 14, today's day 14, and you say, yep, tonight we're going to try. Now, you may have ovulated at 6 o'clock this morning. You'll never know when in the day, so don't even try to, like, finding the day is hard enough, let alone the hour. That's never going to happen. So say, for example, though, you ovulated at 6 o'clock this morning and you and your partner had a conception attempt at 10 o'clock tonight. That egg may not even be there anymore. So what you thought is, oh my gosh, we're having sex at ovulation, this is the perfect time to conceive. You may actually have completely missed it by ovulating earlier. You could also have just ovulated that minute and you have sex and the freshest sperm meets the freshest egg and it's amazing, but that's the risk you're taking. So because good quality sperm lasts for 3 to 5 days, you're actually fertile around about sort of 5 days before ovulation. So when we're looking at conception sex, it's all about the sex that you have leading up to ovulation rather than after ovulation, okay? So it's really important that we sort of start to understand when we might be ovulating. So for those of you who calculated quite a wide ovulation window that I talked about before, so we were looking at your shortest cycle and your longest cycle, counting back 14 days and going, I could ovulate between, say, day 12 and day 18, you want to be then sort of starting your conception attempts 4 or 5 days before day 12, which is your earliest ovulation point, up until day 18 or 19, which is your most likely latest date of ovulation. in a minute when I talk to you about how to work out a little bit more when you're ovulating, you hopefully be able to shorten that window a little bit. But if you're not sure and you can't work out ovulation, you want to try to make sure that you're really covering that window. So after ovulation until our next period, or hopefully we're getting a positive pregnancy test at that time, that's what's called the luteal phase. So basically in this luteal phase, if the egg's fertilized, it implants into the lining of the uterus and produces hormones to maintain the pregnancy, which is really important. Now, progesterone is our major dominant hormone in this second half of the cycle. So around about a week after ovulation, a week before your period's due, those progesterone levels should be peaking. Now, if you were to measure progesterone at this time, which we'll talk about in a second, I would want that number over 30, ideally above 40, and even optimally 50 or 60. I rarely see that in my clinical practice because I normally see older women, and eggs of maybe not as prime quality will often produce lower levels of progesterone. So your progesterone is really directly related to your egg quality. It's not often a standalone kind of thing. If a pregnancy has not occurred, then the progesterone levels will drop back down, which causes the uterine lining to stop thickening and it starts to shed, and the cycle of menstruation begins again. So, that's like a lot of information about the cycle. You can look at my book, Healthy Hormones, for more information. Do a bit of Googling. One of my online courses, we go through all of this stuff there with you as well. So we talked a bit about ovulation and, how do we know if we're ovulating? So most of the women who are menstruating fairly regularly will be ovulating, but yet for some reason, many of the women that I see in my clinic who have not yet conceived feel like they're not ovulating. I think we as women don't have a lot of faith in our bodies sometimes. And I think that, we just like assume maybe that we're not ovulating. So a couple of ways that I use to reassure women that they probably are. And when I say if you've got a regular cycle, it doesn't have to be 28 days smack bang on. It might be 26 to 33. That would actually be considered regular, even though to you it's like, no, it's so irregular. If your cycles are longer than 6 weeks, then you may be not ovulating. Or if your cycles are less than 20, 21 days, again, you may not be ovulating. Hey, but you might be in both of those situations as well. So I'm going to go through now the 5 ways that you can assess when you're ovulating so that you can know exactly when to attempt conception. And then on the flip side, know when is best for not conceiving as well, which I know seems crazy at a Fertility Expo, but I guess I'm saying that so that all this information doesn't just feel like it's for fertility, although it is, but it feels like, actually, do you know what? This is information that's going to be useful for me moving forward, which I think is a much more holistic and less pressury way of thinking about it. So cervical mucus. Why nobody teaches us about cervical mucus? People don't know about it. Many of the women I see in my clinic, 30s, 35, 40, 44s, nobody's ever talked to them about cervical mucus and they don't know what it is. So this stuff that we've often called discharge and sort of hidden away is basically mucus. It comes down from the head of the cervix to the mouth of the vagina, and we're all going through cervical mucus pattern each month. All of us women are in it together, okay? So the best way to check cervical mucus, there's 2 ways. One of them is before you do a wee at some point later in the afternoon, maybe 2 or 3 o'clock, so that it's had time to come down from the cervix to the mouth of the vagina. Also, too, if you're checking it, you probably won't be able to tell the difference between residual semen and cervical mucus until you get really good at it. So hopefully you can see before you get really good at it, but hey. So at some point later in the afternoon, wash your hands before you do a wee, run 2 fingers around the mouth of the vagina and go, what does that feel like? Now, funnily enough, that seems to be the best method. The other method that some of my patients use is what I call the hum method. And that method involves just thinking about it and feeling how it feels without feeling it. It's not super accurate, that method. I don't know why. Anyway, so let's go back to the touching method. Might feel a little bit weird to start with, but you'll get used to it. It's your body. You can do it. Okay. So after your period, you don't need to check cervical mucus when you've got your period. Yay. You might go, there's not really much mucus there. I don't know what even I would call this. I personally call it sticky nothingy. Now, sticky nothingy feels a bit like just dry and I don't know. So the best way for me to explain it is if you've been talking a lot, like me, I talk all day, and you're a little bit dehydrated, you might touch the inside of your cheek and go, what does that feel like? And you've got that kind of just like, it's not dry, but it's not wet. It's that tacky kind of like feeling. So if you touch the inside of your mouth when you're a bit dehydrated, that's probably what that initial cervical mucus feels like after your period. And that's infertile mucus. After that, most women will get like a thick white one. It looks like moisturizer cream. Some women get that in their undies, and they're the ones that use the hum method. They're like, oh, great, I can tell exactly what this one is. So again, that type of mucus is not fertile mucus. It forms a plug at the head of the cervix and sperm can't swim through there, and it's the wrong pH. So if you're thinking you're in the fertile window, but you've got that thick white mucus, and you want to have sex, go for it. But if you're doing it as a conception attempt, it's very unlikely to be a conception attempt. After that, most women start to get a little bit of thinner, clearer mucus. Now, we're not talking about huge amounts of mucus, okay? So we're looking really small amounts. The way that I explain that mucus best is if I have a glass of water and then I run my finger inside my cheek. It's got that kind of slippery, watery, salivary kind of feel, but it's not heaps of stuff. So as soon as you start to notice that, so it's got a slightly slippery kind of clear feeling on your fingers, that's pretty much the beginning of fertile mucus. Through there nicely and travel through your cervix. And that's when you'd be ideally starting every second day of trying to conceive with your conception attempts when you're conceiving naturally. Some women, but not all women, after a couple of days will get a stretchy egg whitey type of mucus. So if you put it between your fingers, you'll be able to stretch it. Now, when you look online, it's like, you should be able to stretch it. Sometimes that does happen for people, but sometimes it's just like a tiny little stretch, and that's okay too. So if you notice that stretchy egg whitey mucus, basically sperm grabs onto the end of that, up into the cervix. It's like a semen slippery dip, and it facilitates sperm into the cervix really quickly. And that is usually your peak ovulation symptom. After that, most women, it just comes down the way that it came up, back to thick and white, back to sticky nothingy, and then your period may come. If you're pregnant, you probably stay with the thick and white mucus for a lot longer and maybe all the way through the pregnancy. But it's really important we start learning about that kind of cervical mucus, because it's actually telling us we're becoming fertile, and you'll probably get that thin, clear mucus, the little stretchy, the little slippery one, for a couple of days before ovulation, which usually corresponds with that 3 to 5 days that sperm would be there and healthy. So once you've hit that ovulation, any sperm that was there or sex that you've had 3 to 5 days ago, all that sperm's there waiting at the cervix, that egg to kind of drop, or up into the uterus, that egg to drop. Don't think about exactly where it is, because there's like millions and millions of sperm there, and I'm like, where is it all? Anyway, don't overthink that. It's there waiting. But after that egg's been released, then that's the end. So it really is good to kind of start to understand your body with cervical mucus. The other and very definitive way to assess ovulation is by doing what's called a day 21 progesterone test. Now, like I mentioned earlier, your progesterone should be peaking a week after ovulation and a week before your period, which for the 28-day cycle people is on day 21. Now, at day 21, that's when you want to have that progesterone level, like I mentioned, ideally over 30 or over 40 or even above that. If, though, you have a longer cycle or a shorter cycle, your day 21 test, which is still called a day 21 progesterone test, will actually not be on day 21. So if you've identified ovulation from another method, you could test 7 days later, or you can sort of try to average it out. If you get this progesterone test back and the number's very low and you haven't yet got your period, and your doctor calls and says, oh, you haven't ovulated, you're like, oh my gosh, I'm not ovulating, I knew it, that's what's going on. It's possibly and probably not that for most of the women I see. They've usually just tested at the wrong time. It's usually that they've tested it too early, and maybe they're ovulating later. So we can't really make an assessment or a judgment about the day 21 progesterone test until you've actually got your period, so we know what it is. So you might think your period's coming on day 28, you do the test on day 21, it says you haven't ovulated, but yet your period ends up coming on day 35. I'm like, well, you wouldn't have had your progesterone being high by then, so we don't have to worry about it. Let's try to test it again next month and work out the days. So don't even sort of think about what that number is until you get your period, so we can work out exactly if it was tested at the right time. The other way, so obviously with that one, we see that we have ovulated, but it's not going to help us with conception because it's telling us much later. It's more for like reassurance that yes, you are ovulating, and also for somebody like me or your doctor to see what your progesterone levels in that luteal phase are like. The other way that can be helpful is temperature charting. It can really help to pinpoint ovulation and does give us information about what your hormones are doing at different times of the cycle. So this involves taking your temperature, your basal body temperature, first thing in the morning, same time each day, before you get up and do a wee and roll over and tend to other children, have sex, laugh, whatever. We're looking at that body temperature at rest. So what we tend to see is that after our period, our temperatures are sort of lowish. They'll often drop down and then they rise up after ovulation and they stay up. If you're pregnant, they stay up. If you're getting your period, they tend to drop back down again. So look, this can be really useful to really pinpoint ovulation for many women. Some women come to me with months and years of temperature charts, and if that's you and it doesn't stress you out, go for it. For most people, it's probably one of the faster ways to insanity, because every day is about, where's my temperature? Have I ovulated? What's going on? Why doesn't my chart look like the perfect chart? I'm really kind of confused. And so, it makes every day about fertility. And I know often it is, but to start the day with that isn't always helpful, okay? So if you want to do it for a couple of months, get an idea of where your hormones are at, where your temperature is at, give it to somebody to help you interpret, and then put it to the side, is my usual recommendation. The other way that can be useful and cannot be useful are ovulation predictor kits. Now, these kits are like a pregnancy test that you wee on, and they help us to determine when you're fertile by detecting a surge in luteinizing hormone. Okay, now that surge in luteinizing hormone is usually 12 to sort of 48 hours, usually about 36 hours before ovulation. So if you get a positive on those tests, you're like, great, I'm ovulating soon, we can have sex, and that could be kind of useful. There's two different types. One of them is the sort of cheap and cheerful, just 2 lines on the stick, measuring LH, sometimes a little bit harder to use for people. The other one, often called Clear Blue in Australia, the Clear Blue brand, is a digital one that looks at estrogen and LH and gives you more of the fertile window and then the ovulation. If these test kits don't work for you, it may be if you're coming up ovulating all the time, it's likely that you have high LH levels, which is often seen in polycystic ovarian syndrome. It doesn't mean you're not ovulating, but the test will look like you're ovulating all the time, which is very confusing. It may also be that your LH levels are not enough to be detected on the kit, but you are still ovulating. So if the kits work for you, you get a positive, it's really clear, your period comes pretty much 14 days later. So you're like, yeah, I can kind of trust it matches up with the cervical mucus. Great, yep, they're working for me, fantastic. If they're not working for you after a couple of months, just ditch them. They don't work for everybody for some reason, and it doesn't mean that you're not ovulating, okay? You can always do that day 21 test just to be sure, but it definitely doesn't mean that you're not ovulating. So they just work for some people and they don't work for others, and that's how it is. Some of them don't give you enough of the lead up, of conception attempts, so just making sure that you will still try to work out when you're ovulating, so you can be starting to try 5 days, at least sort of 5, or not at least 3 to 5 days before ovulation. The last method of ovulation measurement is called ovulation tracking. In Australia, we get 3 free ovulation tracking cycles via Medicare, so they're free of charge. And what they'll do is they're usually through a fertility clinic, and they consist of blood tests and sometimes ultrasound to assess when ovulation is occurring. So they'll measure your baseline hormones, they'll measure your hormones as you're coming up to ovulation, maybe do a scan, let you know, yep, you're ovulating in the next sort of day or so, go home and have sex. They'll usually come and measure your progesterone a week later to see what that's like. And then a week after that, either your period comes or hopefully you're doing a pregnancy test. Now, if you've got a really lovely 28 to 30 day cycle, or approximately, regular cycle, you've done the ovulation wee kits at home, you can tell with cervical mucus, yep, I'm pretty sure I'm ovulating day 14 or day 16 or day 12, whatever it is. I pretty much ovulate then most months. Then what you can do is to do one ovulation tracking cycle and go, great, fantastic. That's, I know what I need to do. And you don't need to kind of keep doing them. They don't make you more likely to get pregnant. They just help to pinpoint ovulation. They're useful though, because some people find that they're actually ovulating a lot later. And so it may be that you actually need to extend when you've been trying and your kind of conception attempts. So I think, that kind of gives you that sort of, I guess, I look at your menstrual cycle, when you're ovulating, when we should be trying to conceive. And it's usually, I would say, every second day in that fertile window, plus at least once or twice out of the window. One, it makes your partner feel like they're not just a sperm donor, which is helpful. And two, it helps to keep the sperm turning over. It helps to keep the DNA of the sperm really fresh, which is important. And three, it's like, oh yeah, we actually like each other and we used to want to have sex all the time and there's no pressure in that time, but it's quite a lovely connecting thing to do. So I could talk all day about fertility and conception and all this sort of stuff, but I think we're probably running out of time. Is that right, Ella? And, just see if there's any questions. If not, I'll just keep talking.
So there is, thank you so much. That was great, because it's something that we really do need. And, I don't think a lot of us know that there's only a short window of us getting pregnant. Because I thought that you could get pregnant, all year, 365 days.
That's what you're brought up to believe. Yeah, have unprotected sex, you'll be pregnant.
Right?
Yeah.
So I have a question. Should we be concerned if we rarely get that eggy white mucus? And what does it actually mean if you don't get that?
Great question. It either means that you did a wee and it's gone and you just didn't check it at the right time, and that's okay. So as long as you're getting that thin, clear mucus, you may not get that stretchy egg whiting mucus. Your estrogen levels may not be enough to actually produce enough of that for you to see, but it still may be in the cervix and they're ready for that semen slip, ready up you go. So if that's the only concern, but you sort of have pinpointed ovulation in other ways, like you've done a day 21 test, I'm definitely ovulating, nothing's kind of changed, most of my cycles are similar, but I'm just not having that type of mucus, but I've got the other thin, clear mucus. There's just not heaps of it. Do not worry. It's so fine. You're not a robot and an encyclopedia. Everybody's not the same, and that's okay. If you're really super dry, it may be that you want to use a sperm-friendly lubricant, like pre-seed and things that kind of give that slippery feel to kind of help to facilitate.
Right, okay. Now, what happens if you've got a longer cycle of 50 days?
Yeah.
Does that make it harder to conceive?
Yeah. Well, it does for two reasons. One, you're never really sure when you're going to ovulate. So how many days in the month can you actually kind of be trying? But again, on a 50-day cycle, you're still only ovulating probably 2 weeks before you get that period, right? So if you're ovulating sort of like day 36 or something, it is a very overly mature egg. So if we ovulate way too early, the egg sometimes isn't mature enough, sometimes too late. It's a little bit sort of over mature. It's not inconceivable though, and I've certainly had many clients conceive on a really long cycle where it's like, what? That's amazing. But ideally you'd be looking at, why is that happening? So is it polycystic ovarian syndrome? Is it some other kind of hormonal imbalance that needs to be addressed? We do that a lot in the clinic using herbs and supplements trying to regulate the cycle, or you can be looking or at a fertility specialist who may give you medication like Clomid or Letrozole to try to get you ovulating a little bit earlier. One, so you get a fresher egg being released, and two, because if you're only getting a period every 50 days, you're getting half as many chances a year to try as somebody else.
Now, what if my temperature or someone's temperature is, what if the temperature chart keeps on fluctuating throughout the month? Yeah,
great question. It's probably driving you insane, and stop testing it. So if you're not getting, if you're just getting temperatures that are just hovering along and not going up at all, you want to check ovulation by another method. If you checked it by another method, ovulation tracking, ovulation pea sticks, day 21 progesterone, maybe with mucus as well, and the temperature just don't seem to be getting it, just ditch that method. It's not working for you. It's not worth the stress. It may be your temperature, the way that you're doing it. It may be your thermometer, and it may just be because you're not a robot and there's other methods to assess. If you're getting it and it's just kind of going up a little bit and the temperatures are very low, it may be that we need to check the thyroid. It may be that your progesterone isn't very high, and so therefore you're not getting really great rise in ovulation. So, you know, if it's not working for you, use another method to assess ovulation that does work for you, because otherwise it just, and that's what I was saying, it's the fastest way to insanity. Sometimes things just don't work for you and you go and do a cycle tracking cycle, you're like, oh, I'm ovulating. Like, you know, if you do cycle tracking, I urge you to also do, people forget this, I urge you to also do all of your other methods at the same time. Because if you do cycle tracking, it says, oh, you're ovulating beautifully on day 14, your progesterone's amazing, great. You've also done the pea sticks and they didn't work. You also did the temperature chart and it wasn't really working. You're like, oh, okay, well, even when those things don't work, I am medically still ovulating. Or you do it and you're like, oh, that's where my pea sticks said I was ovulating too. Cool. I don't have to keep coming for scans and blood tests. I can use those sticks knowing that they're quite successful.
And if you're tracking at the beginning, right at the beginning, do you think it's wise or to go to the doctors to have a blood test at day 1 of your period and then at day 14, so you're checking your estrogen and progesterone levels?
Yeah, I probably would do the day 2 to 3, which is kind of baseline. Day 1, you can still have a bit of a hangover from hormones from the last cycle, and they're sometimes a bit funny. So day 2 or 3 is best. And then I would say day 21 or a week after ovulation, so that you're like, oh yeah, no, cool, I'm definitely kind of ovulating.
Right, okay, cool.
But it doesn't have to be right at the beginning. If you've got a fairly regular-ish cycle, like between 26 and 33, 34 days, for example, you know, I would be definitely trying for a few months before you start medicalizing it.
And what about these natural remedies? So I've seen quite a lot of stuff on YouTube at the moment with maca powder. I'm not sure whether you've heard of that, and that you know, that swears by that it could help you with your natural conception. Now, I don't know whether it's old wives' tale, but you know, are there other things that can help us along 100%. The way?
So there are things that can help us. Maca, I tend to use it more postmenopausally for increasing estrogen, and most of you here are probably not needing to increase estrogen. So I don't know that that's going to regulate your cycle. There definitely are herbs that can be used. Because you need to really have those hormones tested first, they really should be done with a naturopath or a herbalist to actually do it. Because otherwise you might say, for example, take Chase Tree or Vitex, which is quite common. But if you've got particular types of hormonal issues, that's not going to work. You know, so if estrogen's high and that needs to be cleared, you know, we need to kind of work on that. So I would urge you to, absolutely, taking supplements and things like that's fine. But when you're looking at herbs and actually manipulating hormones, it's really going to pay off to actually work with somebody who knows what they're doing and can do it specifically for you.
Mm-hmm. And are there particular foods that that can help? Because, you know, there's all these old wives' tales, I guess, where you eat lots of avocados because it looks like a pregnant woman. And
yeah, as long as it comes from the ground or from nature, go for it. Now, my sort of, I guess, healthy eating mantra that I bang a lot about my courses and all my talks is making sure you're having some protein, some good fats, and something fresh, ideally fruits and vegetables or salad with each meal and most snacks, and keeping your starchy carbs to kind of less than 20% of the meal. So they're more the accompaniment to the meal rather than the basis of the meal. So we know that our hormones don't love all the fun stuff, sugar, dairy, alcohol, caffeine, unfortunately, but they do tend to love, you know, meat, chicken, fish, nuts, seeds, vegetables, fiber, legumes, vegetables, fruits, you know, all that sort of stuff. So, you know, what you're doing all the way through the month in terms of just a healthy eating. I don't want you guys to get really stressed about it. Just try to make most of it whole foods, unprocessed, low sugar if possible. And that's going to be the most hormone friendly diet that you can have.
That's wonderful advice. Is there anyone who had any questions? Because we've got 1 minute to go. So Belinda, thank you so much for your time and your session. It's been really informative because, as I said, you know, these are things that we just don't realize, and without knowing, how we're going to be successful. So thanks again. And I'm pretty much sure if people go across to your booth, I know that I've seen your book at the back there, which I have, and it's very informative.
That's it there, Healthy Hormones. You get it on Amazon.
Are you running a competition also?
Yes, I think I am. Yes, I'm giving away a couple of books, and I think maybe even one of my courses as well. When I say I think, I should know.
Oh,
I am
fantastic.
giving away one of my courses. So yeah, pop your name. I'm not sure how you entered. Do you put the name in the fishbowl at my booth?
Yeah, that's it. Excellent. So everyone, head on to Belinda's booth where you can win one of her books. Thank you so much. And Belinda,
pleasure. And I'll be just, if you come to the booth, I'm going to be in couch time with Amy, Amy Forth, the acupuncturist now. But then I'll be back in the booth at 2 o'clock at the end of that talk.
Awesome. So head on to couch time then. Thanks everyone. Bye.
Thanks. Bye.